The Democratic Nursing Organization of South Africa is one of the organizations calling for a tighter lockdown in Gauteng. Speaking to us now is provincial chairperson Simphiwe Gada. Thank you very much, Mr. Gada, for your time. Obviously, we've heard of about more than 7,000 people who are now admitted to hospital because of the coronavirus pandemic, and I assume this is why you'd be calling for tighter restrictions, because there's a lot of pressure on staff at hospitals.
Well, thank you, and afternoon to the viewers. Well, indeed, you've captured it very well that we are indeed concerned on the number of cases that have doubled. Our worry is based on the fact that the issue of bed capacity in hospitals, but also, you know, the banning of Charlotte Maxeke. It gave us dealt us a heavy blow, because remember that was one of the central hospitals that were used to in terms of managing COVID. But throughout the province, we would recall that many health workers have not taken leave and they've been battling this COVID-19. So issues of fatigue on the staff is something that counts. We think that South Africans, in their reckless behavior, are not really thinking about the people who are actually at the forefront of fighting this pandemic. So hence we have called that we must be able to regulate and enforce stricter lockdown regulations, because we think that even the police have relaxed in terms of enforcing these regulations. I mean, after 11 o'clock, you still see people, up and down. When was the last time we have seen roadblocks and all those things? So, and if you walk around, people are walking around without masks. You go to malls. We also monitor the social networks, where we see that people are having social gatherings. And in those social gatherings, they are just relaxed as if COVID-19 has left us, whereas COVID-19 is still with us. So we still see a lot of super spreader events happening, and without the law enforcement really enforcing lockdown regulations.
All right, what do you say to people's sentiments that government's slow rollout of the vaccine is also adding pressure to this third wave becoming a reality?
Well, I think that scientifically we all know that we have been able to survive and dodge COVID-19 in certain instances because of the mask. Look at the hospital, for instance. We know that the mask has been proven to be effective. The PPE has assisted our frontliners not to get COVID-19. So we cannot place the blame on the issue of the slow pace of vaccination. Vaccination is happening, though even ourselves we are not happy with the pace in which it is happening. But we've got to understand that we must also take personal responsibility for our own lives. We must not place the lives of our loved ones at risk because we want to blame vaccination. Vaccination is going to happen. It is happening, though it is not at the pace that we prefer. But people really should consider that this disease or this virus is here to stay with us. It will still require us, even post-vaccination, people will still be required to exercise, responsible conduct as they interact with each other.
Mr. Gada, as the NOSA, which part of the restrictions would you like to be tightened?
Well, without focusing on the issue of alcohol ban, we think that we must be able to control, the availability of alcohol without banning it. Also, the issue of social gatherings, we believe that there's no stricter control around social. People are having parties. The issue of clubs that are open, those are super spreader, venues, clubs, chisanyamas and all that. People should really consider the issue of political gatherings as well. For us, it's a worrying factor because we know that there are certain political gatherings that are still taking place. The issue of the curfew, because people move up and down because of having these social gatherings. So we don't see the police enforcing the issue of curfew. We think that we must also look at the issue of the the inter-provincial travel. It's something that we should also explore because people are moving up and down freely. But if you go deeper into the transport sector, for instance, you look at the public transport behaves as if there's no COVID. It's taking people up to 100% full capacity. Even for long distance, we have seen that buses that travel between provinces are not really adhering to COVID-19 regulations, where people in these buses, sometimes they only take the mask on when they enter the bus, but once they are inside the bus, they take out the mask. We understand that the long journey can sometimes be frustrating, but we think that there should be stricter enforcement. Also, if you look at the issue of contact learning, we think that contact learning should be suspended because we have seen that more than 2,000 learners have tested positive for COVID-19. I mean, there's a school that is not far from where I stay, around Kempton Park. We are seeing that cases are coming of students testing positive for COVID-19. So we think that those issues should really be considered, and people at all times must be aware that COVID is still here with us. And the best way to defeat COVID, which has been proven, is that if we exercise strict hygiene, we also do not take for granted the wearing of masks, we'll be able to defeat COVID-19, you'll be able to protect yourself. So we think that it can be that our law enforcement agencies are tired, whereas the healthcare workers are not tired and they are still fighting this virus.
Does DENOSA have any statistics right now, Mr. Gada, in terms of frontline workers or healthcare workers who have been diagnosed with COVID-19 ever since this technical third wave?
Well, we don't have that. They currently, as I'm talking to you, they are our representatives who sit in these committees are in a meeting, and we have requested them to get these stats. We've been requesting these statistics. It's one of the problematic areas that we are encountering with the department. That can we get these statistics reported to us? But we have tasked our people to get those stats for us, and when we get them, we don't mind sharing.
All right. That was Simphiwe Gada, DENOSA Gauteng's chairperson, speaking to us there. Thank you, sir, for your time.